And earlier on our show today, we heard about a new art therapy program that's giving cancer patients on the island a creative outlet for coping with their diagnosis and treatment. A local doctor, Nancy Yao, and an island-based art therapist, Kristen Griffin, have started the group, and they hope it is the first of many art therapy programs across Prince Edward Island. Until now, the artists, studio space, and supplies have all been donated, but now there are plans underway to set up a new art therapy cooperative for P.E.I. Island Morning's Nancy Russell with more on that story.
Hi, my name is Jim Bruce. I have been on the island for 7 years. I'm retired from the world of advertising where I worked in the creative side. I have a degree in fine arts. I am an artist and also kind of a writer too. And I want to get involved with this whole effort that Kristen and Nancy are doing because I think it has tremendous value.
Tell me about the idea of a cooperative. How would that work?
Well, I managed a cooperative here on the island for about a year and a half, the Island Media Arts Cooperative. We're in the process of setting up a cooperative, as I speak, and it would be like a nexus for anyone who wants to do something creative with the arts in this kind of a field. It would be a not-for-profit organization, but the cooperative could go to an institution and say, we offer these services. We get the funding, or the cooperative gets the funding, and either the board or the proposals committee works with members to set up something that will then be offered and decide on fees and remuneration for the members who are participating, which is a lot like what went on at IMAC whenever there was funding coming in. You try to set up programs for members to do what they do best.
And why do you think that kind of structure is needed connected to art therapy?
I think for the simple fact that there's not a lot of art therapy being done, and certainly by my knowledge, nobody with Chris's experience and training, our target would be the palliative care center, hospices, old age homes, any kind of an institution or organization where there are people who would benefit both, physically and mentally from being intensely involved a couple of times a week in something that gets them out of the mental state of I'm not well and gets them into their own self, their inner self, at a very sort of deep and creative level.
So I just wanted to bring the two of you back in. Nancy, what do you think of the idea of there being a cooperative for arts therapy?
I'm very excited that this is all coming together. I think it does meet a need here on the island. Other provinces have art therapy programs in place, whereas P.E.I. does not. I sort of see this cooperative going in many different directions, and we've already covered sort of two patient groups, right? We have the oncology patients, and we have now people who are in palliative care. They do not have to be admitted to the unit, but who are palliative. I see it going in the future to other different patient groups that could definitely benefit. There are many mental health groups out there who would benefit from art therapy. There are lots of people who are coping with chronic pain every day, and there are therapeutic benefits using art for pain. I sort of see it as going to all the different areas of medicine and helping people in a way that supports their medical care provided by, hospitals and doctors and that sort of thing, and adding another dimension to their care.
And Kristen, what do you think of the idea of the co-op? How is that going to help you do more of art therapy?
Well, I think it's important that we get our name out there and that people understand that there's a resource that's going to become available for them to utilize. And I also am really interested in other doctors besides Dr. Nancy Yao getting in touch with us and actually having the conversation. How can art therapy assist me in my practice? What will this do for my patients? Because we can creatively come up with programming that will suit specific needs. And that's something that I think is really important to understand, that, if someone is, say, they suffered a stroke and they're going through a recovery stage, when you're using art therapy, when you're using music to stimulate, your brain, when you're using the visual arts to stimulate your brain, and when you're using things combined together, you are actually activating every single neural system in your entire brain. And so it's really interesting for someone in particular who has brain injuries, or dementia. And I think that that's really exciting work. So there are so many different aspects to this, and we can explore all of them. And I'm happy to talk to anybody who would like to contact me.
Thank you very much.
Thank you.
Thank you.
Thank you.
Island Morning's Nancy Russell speaking with Jim Bruce, Dr. Nancy Yao, and Kristen Griffin. And Nancy has posted a video about the art therapy program on our CBC Prince Edward Island Facebook page.